millions of people die in the United States from chronic diseases, yet many of these deaths are preventable. According to the Center for Disease Control, half of all adults in the United States have a chronic health condition. These are startling statistics, yet people go about their lives unaware of the things that affect their health. There are those who try to manipulate and influence factors that have a direct impact on your health. For these people, corporate profits are more important than your well-being. Have you ever wondered about the startling rise in chronic diseases over the past 20 years? We've all heard people say, "You used to not hear about all the diseases we have today." Were they here all along and we're just getting better at diagnosing them? Or are more people developing chronic conditions like cancer, diabetes, heart disease, and stroke? In this documentary, we will take a look at several important events in history and note an interesting correlation in the rise of certain diseases. In some cases, we will provide a little background to make the information more meaningful. There is a lot of information and a lot of misinformation on most of what we're going to cover. Trust me, we will only scratch the surface on some of these issues. So why did we create this documentary? Our goal is to challenge the status quo and to start a conversation about healthcare and nutrition in the United States. You may be surprised by some of the information presented, but I encourage you to do your own research and to talk to others who do not have a financial interest in your well-being.
It's not in their interest to practice preventative medicine because they make less money if they do that. So it's that simple. So, if you don't get sick ever, you're not going to the doctor, you're not giving them any money. And they'll notice, in these insurance companies and stuff, they have actuaries and they have people who really keep track of the numbers, and they've probably got it worked down to a science where they will see that if they start doing preventative medicine, they take a real big hit to their checkbook. And so there's basically what it is, it comes down to, in modern medicine, I consider it just a violation of the Hippocratic Oath.
What it all boils down to, quite frankly, is that we are victims of a Machiavellian medical monopoly. We don't have a free medical marketplace. We haven't had a free medical marketplace since the early 1900s, and, absolute power corrupts absolutely. Quite frankly, if you're not angry, you're simply not paying attention, or you're not educated with the proper information, and that's really not your fault because that's the result of a monopoly.
It's because we have a system of medicine that is fundamentally stupid. Consider how the system works. First, we do nothing to prevent disease. We wait for people to get sick. Once they are sick, instead of curing their disease, we suppress the symptoms by prescribing toxic chemicals and doing surgery. Then the toxicity of the chemicals makes the patient even sicker, creating entirely new diseases. And then finally, to hide the fact that the patient is now sicker than when they started, we don't call these new problems diseases, we call them side effects.
If you've been listening to my lectures for last year, you know that my passion is our kids. And experts tell us that our children are going to be the first generation of Americans that do not live as long as their parents. This is a catastrophic prediction of biblical proportions. We're talking about the Great Flood. We're talking about all of Egypt's firstborn dying because Pharaoh refused to release the Hebrew slaves. Can you imagine everybody in this room burying their children? This tells us how terribly the medical profession has failed us.